Everybody, today I will be talking to you about implantable cardioverter defibrillators. I'll be talking about what they are, why you might need one, how they're implanted and how they work, what kind of questions you should ask your doctor or nurse, cautions and contradictions in relation to exercise and physical activity, the benefits of exercise and exercise guidelines and prescriptions. So what is an implantable cardioverter defibrillator? Well, these are also known as ICDs. They are battery-powered devices placed under the skin that track your heart rate. Thin wires connect the ICD to your heart. If an abnormal heartbeat is detected, the ICD will deliver a quick electric shock to the heart and restore a normal heartbeat. ICDs are useful in stopping sudden cardiac death in patients who have sustained ventricular tachycardia or fibrillation. So why might you need an ICD? A doctor might suggest an ICD if you are at risk of ventricular arrhythmia, tachycardia, or fibrillation, which could be caused by the following: congenital heart disease, heart attack, or if you have survived cardiac arrest. So if you are going to receive an ICD, you might want to know how one is implanted. An ICD is implanted under the skin through a small cut just below the collarbone. Electrical wires connect the ICD to the surface of the heart or to the inside of the heart. These wires are able to be installed through blood vessels, which prevents the need to perform open chest surgery. The ICD monitors the heartbeat through these wires and sends electrical signals to the heart when required. So now that these things are implanted, the patients who have ICDs might not know how they work and might have questions on how they work. So we'll cover a bit of that as well. There are electrical signals created by the SA node in the heart. These signals travel through the heart and make it beat. The SA node determines how often the heart beats per minute. The ICD senses when the heartbeat is abnormal and attempts to return it to its normal pace. A healthy heart will beat around 60 to 80 times in a minute. Some ICD devices have pacemakers that will shock your heart with small electrical signals if the heart is beating too slowly. When your heart is beating too quickly, the ICD pacemaker will send out defibrillating shocks to bring the heartbeat back to a normal pace. During ventricular fibrillation, the heartbeat can increase to over 240 beats per minute. This is caused by electrical signals shot out in an uncontrolled manner. This is not caused by the ICD device. This is just the heart doing its own thing. These uncontrolled electrical signals cause the muscles of the heart to seizure and kind of quiver instead of contracting and beat and making a normal heartbeat. Normal electrical signal regulation is no longer in effect, and when this happens, blood stops pumping throughout the body. And because there is no blood flow, the brain will be oxygen deprived, which could result in sudden cardiac death if the heart and blood flow are not restored. If the heartbeat and blood flow are not restored quickly. Ventricular tachycardia, more commonly known as a racing heart, is often experienced previous to ventricular fibrillation. The ICD can usually slow the rhythm of the heart and stop ventricular fibrillation by sending out quick and mild electrical signals. This is painless for the patient and can prevent sudden cardiac death. And here we have a picture of kind of what the heart rate would look like when a heart is going through ventricular fibrillation, and the little yellow stars on the heart there are the uncontrolled electrical signals that are causing the heart to seizure and quiver. If the ICD is unsuccessful in preventing ventricular fibrillation, it will send a powerful electrical shock to the heart. This shock is called a defibrillation, kind of like what you see in the TV shows when they take the pads and shock a dead person. This will stop the ventricular fibrillation and bring the heartbeat back to normal. So what kind of questions should you ask your doctor or your nurse about living with an ICD? You will probably live a normal lifestyle. The best plan is to ask your doctor what you are able to do or what you are able not to do with living with an ICD. Some good questions would be when you would be able to resume normal activities. What will it feel like to have an ICD implanted in you from day to day? When you could expect a shock. Does the shock hurt? Can you play sports? Can you work out? Can you swim? Can you run? Can you do your normal activities that you normally do? So now we'll cover some cautions and contradictions in relation to exercise. If you have an ICD, you should always wear your ICD identification bracelet and have your ICD identification card on you so that emergency personnel and others around you will know how to treat you and help you and know that you have a condition. You should always exercise with friends or family who know of your condition and know what to do in case a problem arises and you need help. If you are an athlete or a regular exerciser, you should talk with your doctor so your ICD is adjusted, or it can be adjusted, to recognize a normal heart rate increase from exercise compared to an abnormal heart rate. Powerlifting, lifting heavy weights, and anaerobic interval training are not recommended for individuals with an ICD because these activities could lead to huffing and puffing, and this could also lead to an arrhythmia. You may experience a significant decrease in fitness during your recovery period, but you just work your way back up slowly, and you'll get back to where you were before. While exercising, stop immediately if you experience unnecessary shocks, chest pain, or extreme fatigue. You should always use the rate of perceived exertion scale. Sorry, I forgot to click the slide there. But you should always use the rate of perceived exertion scale and monitor your heart rate closely. ICDs can be affected by magnetic or electrical fields. In a gym setting, BIA technology is used to test body composition. ICD patients should stay away from this and use methods like skin folding or other methods that don't have electrical fields or magnetic fields that could disturb the ICD device. So you should always be very cautious in engaging in contact sports like football, hockey, and scuba diving is not recommended in case you receive a shock underwater or you are unconscious for some reason related to the ICD. So for those reasons, scuba diving is not recommended. Some other devices, technology you may want to stay away from because these could affect the ICD device operating correctly. These devices consist of anti-theft systems, metal detectors for security, such as those at the airport, cell phones, MP3 players, maybe wireless headphones, radios, extracorporeal shockwave lithotripsy, magnetic resonance imaging, so MRIs, those with that CAT scans, those you want to avoid those as well. Radio frequency, high frequency signals, short wave or microwave diathermy, transputic radiation, transcutaneous electrical nerve stimulation, such as TENS machines used by chiropractors, and you'll also want to avoid electrolysis, electrocardiorization, power generating equipment, arc welding equipment, jumper cables, magnets, ab stimulators, electronic body fat scales, magnetic mattress pads or pillows, gas powered equipment, well, only some gas powered equipment. Obviously, you can still drive a car. The doctor may want you to wait a little bit before you drive a car, just to make sure everything with your ICD is working well, because you wouldn't want to have an accident on the road. You'll all want to avoid car battery chargers, maybe some gasoline ignition systems, electric fences, and electrical pet containment systems, such as the barking collars and like any, I guess, electrical fences that would keep your pet contained, and transformer boxes. We'll cover some benefits of exercise. So benefits of exercise with an ICD. This exercise will help counteract the deconditioning that may occur with the implantation right after the surgery. It will decrease risk of heart disease, high blood pressure, cholesterol, diabetes, and obesity. And if you have an ICD, then these things are things that you would probably already be at risk for, so exercise would be good to help reduce the risk of suffering from these. Exercise will help decrease mortality and decrease anxiety and depression. Exercise will also improve your exercise capacity and fitness level, your quality of life. It will improve cardiovascular health, weight management, body composition, and muscular endurance. So training with an ICD is not so different from training normally. Or training a normal person, you can do mostly everything a normal person can do, with just a few precautions or exceptions. So it is recommended that you follow any restrictions on activity there may be, and recommendations from your doctor. You are encouraged to be physically active, like doing what you would normally do and what you enjoy, taking short walks, and moving your arms and legs to help the blood flow and circulation throughout the body. You should ask your doctor about how and when to increase physical activity. Typically, you should wait 1 month at least before lifting heavy items or doing any high-impact activity. Ask your physician about engaging in full contact sports that could damage or dislodge your ICD or wires. You may be able to... Next slide. You may be able to perform all of your normal activities within a few days of surgery, other than the heavy lifting or high impact activities mentioned on the previous slide. Once your physician allows it, you can probably even return to strenuous activities. Eventually powerlifting, heavy lifting, and the anaerobic interval training, those may eventually be options again after you have been working out and exercising for a while and your fitness level has increased. Remember to always be careful and cautious. Don't overdo it. Quit before you're tired. The proper amount of activity should make you feel better, not worse. Not like you want to throw up or faint. Now we will cover the FIT principles of exercise guidelines and prescription in relation to having an ICD implant. So after your surgery, you will want to start exercising. Maybe with you'll take a week rest, and the second week you will start exercising. You'll want to start with 3 days per week, and add days as your body recovers and grows stronger. You'll want to include lots of normal daily physical activities such as walking, doing the dishes, doing laundry, and for intensity, you'll want to start with a low intensity, 5 to 10 minute warm-ups, and this will help prevent a sudden spike in your heart rate. It'll warm your heart up. It'll bring your heart rate up slower, at a more normal pace. If your heart rate jumps up too quickly, it could trigger a shock from your ICD, and you don't want that while you are working out. Your workouts should consist of a low to moderate intensity, and you can increase the intensity as your body adapts. The target heart rate should be about 60% to 75% of your maximal heart rate. And if you are using the rate of perceived exertion, you'll want to be around a 4 to 6 on the 0 to 10 scale. So for time, you'll want to start short with short workouts, and as your body adapts and you grow stronger, you'll want to add time. And you could begin with 15 to 20 minute walks 1 week, and the next week move up to 30 minutes and 40 minutes, and so on and so on until you reach the desired time. So, and lastly, finally, we'll cover the types of exercise that would be beneficial. So you can pretty much do any type of exercise. You're not too limited with an ICD, except for in the beginning when you're just recovering, and you want to avoid like super heavy lifting, powerlifting, heavy resistance training, and anaerobic interval training. But most other types of exercise are recommended and welcomed. So aerobic exercising, such as walking, cycling, ellipticals, rowing, dancing, aerobics classes, and yoga. Those are all recommended. Just do whatever suits you best, whatever you enjoy, whatever you like. For resistance training, you'll want to stick to lighter weights. Heavier weights, again, may lead to an arrhythmia, which you do not want. You'll want to start with 1 to 2 sets of 10 to 15 reps, and work your way up to 3 to 4 sets of 10 to 15 reps. So that is the exercise guidelines and prescription for patients with an ICD implant. Here we have the references. Thank you for listening. Have a good day.